Good morning or evening, Marta.
Yep, good evening.
How are you?
Good, staying awake.
I've got my coffee too.
Yeah, it's 7 for you, right?
Yeah, it's okay. It's not too bad.
Are you a morning person or an evening person?
Rather morning, so.
Okay, that works. I'm an evening person, so it somewhat works. Great. So are we expecting Marie to share the slides and run it, or do you want to do it since you're starting?
I think
you want to do it, Vincent?
Marie will do it, or.
Great.
But Mauricio, maybe you can tell us. Is Marie going to take us through the slides?
Here.
Hi there, this is Leticia. I'll be sharing the slides, Vincent and Marta.
Okay, great. Thank you,
Excellent.
Leticia.
We have now 10 participants who are joined and listening.
We are at 13 participants. I'm not sure we're going to get many more. There have been a few. So it's whenever you're both interesting to have somebody finishing an evening and somebody starting the day. But thank you. Thank you both for doing this.
Okay, why don't we get started, Mauricio? Good morning, afternoon, or evening all, depending on where you are, and thank you very much for joining this webinar. So I will be alongside Marta, presenting some key elements of this expression of interest, and most importantly, answering questions and answers. So why don't we start with introductions? My name is Vincent Bretin. I'm the Director of Results at United, and specifically coordinating our work in diagnostics for COVID. And Marta?
My name is Marta Fernandez, and I lead the product development and the innovation efforts at FIND.
Thank you, Marta. So we'll take you through a few slides. Obviously, you probably have all seen the expression of interest, but we think it's maybe helpful to recap a few key points of the expression of interest, and then we'll open for Q&A. Next slide, please. So let me start by a recap of around the Access to COVID Tools Accelerator, which is the framework within which and the partnership within which this initiative started. So the ACT Accelerator, as we call it, is an initiative that was started end of April, and that convened together a number of global health partners to tackle the rising challenge of COVID. And this is an initiative that was launched with the president of the European Commission, the president of France, a number of heads of states, as well as key partners at the end of April. It's focusing on three what's called pillars or partnerships around the three big types of commodities that are needed to respond to the COVID pandemic: vaccines, and where we have CEPI and Gavi as co-conveners, but then a number of partners, including WHO, that are contributing and part of those efforts. On the therapeutic side, we have the Therapeutic Accelerator and the Wellcome Trust specifically, together with United, that are co-convening, and again, with a number of partners contributing. And finally, on the diagnostic side, FIND and the Global Fund are co-convening a group of partners with a number of us, like United, contributing in various ways. Next slide, please. So focusing on the diagnostics component of the accelerator, which is really what we're talking about today, I wanted to share a bit more about how we have organized ourselves, who's participating, and what's really the goal of this accelerator. So as you can see here, looking at the different buckets on the slide, we've really are focusing on challenges and issues that are across the value chain of product introduction for diagnostic technologies. We realize that there are gaps and needs across that value chain that we need from an R&D standpoint and a development standpoint to really support the introduction of products that have higher performance, that are easier to use, that are fit for purpose for, in particular, for low and middle income countries. We realize that there is a need to shape markets and support markets to be established. And this is where United and FIND together are co-leading the work together with a group of partners. There is a supply group as well, and a focus on supply to procure and deliver the test, in particular for low and middle income countries with donor-funded financing. And finally, a need to also support countries in terms of preparedness, and that's the work led by the Africa CDC and PAHO, which is quite a lot focused on molecular tests and platforms, obviously, given the need for supporting the expansion of capacity in countries, for instance, but there are also relevant components for rapid tests, as we will discuss today. I'll flag as well that there's a number of other work streams you can see here on the slide at the bottom that are supporting the work of this group, whether it's about modeling, and there's been already some interesting work done by Imperial College and the World Bank to show, for instance, the value add of and the public health benefits and economic benefits of testing, and really making the case for testing and ensuring that all stakeholders, whether at country level or at global level, see the importance of testing and really support that. There is also a private sector working group that is helping us connect with some of you, companies that are involved in this space, and ensuring that we have also the perspectives of the private sector that are factored into the interventions that we design. And finally, civil society, a civil society group. There is one investment case that this group of partners developed, must have been more than a month ago now, which is public and you can access if you're interested, that explains really what are the objectives of this partnership across this value chain, and also what's the funding ask, because of course this work requires financing, and there's been an estimated $6 billion that is needed to do what is described here, and to achieve the objective of having, in particular for LMICs, 500 million tests reaching countries in the next 12 months. Out of those 6 billion, there is a short-term need of 2 billion, and that's the basis we're using, all the organizations that you see here, to mobilize resources. And there's been a lot of efforts from the global community to mobilize resources to support these activities. It's still ongoing. I think what this expression of interest is the result of successful resource mobilization, and we have funding to dedicate to those activities. But we're looking to expand that, in particular, to be able to continue support other aspects of this important work. Next slide. So just talking maybe a bit more specifically along the value chain about what the partnership is trying to achieve. From an R&D standpoint, it's really about bringing well-performing, affordable, rapid diagnostic tool to the market, accelerating their development, accelerating their regulatory approval, and also from a platform standpoint, creating robust digital and analytics solution that can support the use of those tools. From a market readiness, and this is between R&D and market readiness, this is where this expression of interest came from. Here, our objective is to implement market shaping interventions that will, on one hand, support the assessment of product performance, but also support the expansion of manufacturing, the commercialization of product, support price negotiation, and also support in-country regulatory approval of products. The supply group here is here to essentially supply and deliver products, ensure equitable distribution, and there is a role for this group to also do an allocation of the available volumes, and there is emphasis on low and middle income countries. And finally, country preparedness focused around strengthening health systems and building country capacity. Next slide. Can we move to next? Thank you. So in terms of this expression of interest, this is essentially where we came from and why we, alongside with FINE and the ACTA partnership, felt that there was really something to be done around antigen RDTs. Looking at this category of products specifically, and I would flag that the ACTA partnership looks at all diagnostic technologies in general, all the ones that are relevant for COVID, but this expression of interest is specifically for antigen RDT. And here what we saw on the market is on one side, very few products that are meeting the performance requirements, and we know that the WHO target product profile is likely to be published in the coming days for public review. So that will, of course, set clear expectations for all manufacturers and developers. But from the initial signals that we get and initial evaluations, we're seeing few products with those the level of performance that would be needed for use in the response. We're also seeing very few companies that would come with significant manufacturing capacity, and in particular in light of the demand. As I mentioned earlier, our initial estimates for our investment case are that we need 500 million tests, including a high proportion of rapid tests for the next 12 months for low and middle income countries. And obviously we realize that this is very, those are very high volumes, very high compared to what we see in other diseases, for instance, and reaching those kinds of volumes in such a time frame is going to be challenging. And finally, one of the challenges that we see and across technologies is availability for low and middle income countries. There is competition across countries. There is vulnerability in the supply chains, and so those are challenges we really want to tackle upfront for antigen RDTs. So the expression of interest aims to address some of those challenges by supporting innovation and activities that will help accelerate the development of those products, that will help increase their production, and also from a access standpoint, and on the far right of this page, we see this as an opportunity also to secure access commitments for low and middle income countries and to diversify from a geographic standpoint the supply chain. Next slide. So I'll just introduce the two key objectives of the expression of interest and then hand over to Marta to take us through a bit more detail. But really, there's two objectives that we have through this expression of interest. We want to identify partners that we could support financially and technically to do two things: to accelerate the development and market entry of quality assured SARS-CoV-2 antigen RDTs for expanded use in low and middle income countries. And we want to also support partners in creating the supply conditions, and that means manufacturing capacity, diversity of supplier base, and also affordability, meeting the needs of low and middle income countries. So I'll hand over to Marta to take us through a bit more details around that. Marta, over to you.
Thank you, Vincent. So maybe next slide. So first on the product, as Vincent was mentioning, right? Really the key here that we're trying to target is we're looking for solutions that will enable active case diagnosis in a decentralized setting. And, you know, as we were discussing this internally, there are different ways of addressing this. One is antigen RDTs, the other one could be point of care molecular testing. This particular call is focusing on antigen RDTs. With that intended setting in mind, so early detection of the active infection, what we're looking for is a decentralized setting, so outside of laboratories, that is used by healthcare workers, or preferably with lay users with a very short training and no cold chain storage. In terms of usability, it has to be a simple to use test with a few handling and the operating steps. Just gonna, perfect, wait for the slide to come back. In terms of the usability, again, as we have been seeing, and I'm sure a lot of you in the audience know, right? One of the main challenges with the antigen testing that we've seen so far is sensitivity. So the question is, how do we achieve sensitivity that is clinically useful while keeping a test that is still simple to use and meets these kind of usability and target setting requirements? What we've seen so far is that, you know, some of the tests that are in the market that use a reader are able to achieve higher sensitivity. And therefore, we are, although a visually read test is preferable from a setting perspective, a reader is acceptable if it enables achieving that higher clinical sensitivity that is required. And we're also looking into solutions that employ easy to use, easier to collect specimens. You know, most of the initial tests we're working with from nasopharyngeal swabs as well as oropharyngeal swabs. So we are looking into specimens that are easier, such as a nasal swabs or perhaps oral fluid, if the candidate can show data to show that it's feasible. And I think data on antigen testing is still scarce. So it's not very clear how feasible oral fluids are, and perhaps it's different parts of the oral fluid that we should be looking at, but nasal swabs also acceptable. And in terms of performance, I mentioned this, what we're looking for is a diagnostic intended use diagnosis, meaning we need to have excellent sensitivity, more than 97%, and maximizing the sensitivity to minimize the false positives, of course, and looking at tests that are able to target that 80% sensitivity or higher. Next. So, you know, I think the EOI maybe can be summarized in there are two major focuses here. The idea is we need to have these fit for purpose tests. We need to have these tests with high sensitivity that are still usable in the target settings, and we need to make them at a scale that can meet the demand globally, really, in high-income countries as well as low middle-income countries. This EOI is focused on making those available to LMICs. So the EOI is really targeting solutions, ideally that tackle both. So both developing the good performing tests and then making them available. But we're also conscious that different groups may have the ability to address one or the other challenge independently. So we're looking for innovators who have specific solutions to improve performance of the test while maintaining usability. So things like reagents, particles, innovations on readers and others. We're looking at rapid test developers that may have a really good test, but they may not have either the manufacturing capacity or the distribution channels in LMICs, and they may want to partner with a larger player. And you know, those partnerships could take many forms, and we are really open to all of them, so long as they work for both of the parties involved in the partnership. We're looking at IDD manufacturers that may have that capacity. And you know, some of the things we've been hearing from some of you in the audience is with the initial high demand, or I think the initial thought that there would be a really high demand for serology RDTs, there was this huge manufacturing capacity that was developed and was reserved for antibody tests for COVID. And it turns out that demand for serology test is not there. So a lot of manufacturers now have this underutilized capacity that they would be willing to turn into an antigen test. So we're also looking for manufacturers that would have that capacity and would be open to establishing a licensing or a contract manufacturing or OEM arrangement. Again, we're open to what type of arrangement, but essentially open to manufacturing a test developed by a third party. And then in order to address, you know, the last component is in order to address that vulnerability in LMICs that we've seen since the pandemic started, is we are particularly interested in local production that can then serve a specific region in LMICs. And this is trying to tackle the issues with import and export restrictions and with high income countries essentially pricing out LMICs by offering really high prices. So really having this dedicated manufacturing capacity for LMICs in specific regions. You know, all of this, and you know, we also need to be realistic. All of this is compressing time, right? Like we're looking here at an emergency situation that we need to address immediately. So just to put some fine points around what we're looking for innovators and we're looking for solutions, but these have to be solutions that can be rapidly translatable in a product that is going to be manufactured in the next 12 to 24 months, right? So this specific EOI is not looking at very early stage, out of the box innovations, which are needed. We're totally in agreement, are needed. It's just not the focus of what we're looking for here. And I think the same when we're talking about manufacturing capacity, right? Like we need to have a sense that the proposals for expanding manufacturing capacity or for creating new manufacturing capacity can be done within the realm of the timelines of the EOI. In terms of the budget, we currently have an initial envelope of $40 million with an expectation to support 2 to 4 proposals. I mean, and all that is going to depend on the quality of the proposals we get, the investment required in those proposals. And the ACT Accelerator, as we speak, is receiving pledges on a rolling basis. So that's why we're saying this is an initial envelope. This funding could be expanded if there are more proposals that are worth funding, and if we receive further pledges from the donors. In terms of the funding mechanisms, there could be several. You know, I think we mentioned we are open to grant funding, loan funding, perhaps for some of the more capital equipment and facility building. We're also considering, as part of the broader ACT Accelerator, pool mechanisms in terms of market interventions. Those would also be considered. And then, of course, in addition to the financial benefits, there are also non-monetary benefits in terms of providing expertise to the partners and helping to do some of the matchmaking. Something that I didn't mention before is we accept applications from independent parties as well as from partnerships pre-form. And if an individual application is only one part of the solution, we would love to work with that particular applicant to do some matchmaking and see how we can then get to the final solution. So I think next slide. So this goes back to, you know, in the EOI, I think we specify some of the selection criteria, and really the key one and the first one is we need to be able to deliver these 50 million tests within a year. We know it's a very aggressive goal, but it's important. Again, it's an emergency situation. The demand is high, and we need to get the test soon. Now we're also looking for a portfolio of solutions. You know, ideally we would have a solution that is able to address this demand or is starting to address this demand in the next 3 to 6 months. So 12 months is kind of in the in-between, but if we can get something that already is able to manufacture at larger scale and start delivering tests in 3-6 months, that would be ideal. And we can combine that with like a 12 to 24 months different solution that is perhaps addressing more of the long-term sustainability for local production, for example. So that's why we have kind of like a broad range of solutions that we're exploring, where we need to match both short-term needs with long-term investments, as well as the different players. So essentially what we're looking for in terms of the criteria is this ability to supply LMICs with the tests. And we've discussed that. And, you know, every negotiation is going to be different with the applicants that are down selected, but at the end it's going to come down to a certain commitment to supply a percentage of the RDTs that are manufactured to LMICs. We already discussed that the products will need to meet the WHO TPP. We are providing interim guidance on performance. As we discussed before, the WHO TPP will be published in the next few days, and that should override the interim guidance. We are really, I mean, we're really looking forward to that commitment. So what is the candidate able to commit for supply to LMICs, as well as this demonstrated experience of the team that is going to undertake the proposal. And again, just to emphasize the decentralization of the manufacturing capacity in LMICs is one of the longer term goals that will be addressed as well. So next slide. Thank you. So just to finish a little bit on how the process is going to go. So as you know, the EOI opened last Friday, July 4th, and it's going to be open for an initial deadline of July 24th. So that's 3 weeks. And what we're looking for in this initial step of the expression of interest is a PowerPoint presentation, 20 slides, that will then be presented to our review panel. So we're establishing a review panel that is external to Find and Unitate that will be reviewing these proposals, and then we'll be making recommendations to Find and to Unitate and to the working groups at the ACT Accelerator. And that's where funding decisions will be made. We expect, after the EOI closes, we'll expect about 2-3 weeks to down select for the review panel to review and down select the proposals. Then start discussing these recommendations for funding. And after that, we will go back and engage with the selected candidates to start thinking about what an agreement would look like and requesting more information. So start some of the negotiation. We'll start this second step with a larger number of candidates than what will be funded. And at that point, we'll request the kind of like a full proposal in the form of either a business plan or a development plan, depending on what's more appropriate. At that point too, we will start doing some of the matchmaking as requested by the applicant. And one of the requests that is already expressed in the EOI is we need commitment to a pretty compressed timeline. So we're hoping to make decisions within 2 to 3 months of the EOI being opened. I think that's it. Is there a next slide? Perfect. So I think that's it for us, but we would really love to hear from you and hear, you know, any questions you may have. We understand that this EOI is a little bit broad and maybe it needs more clarification. So happy to take questions.
Just a quick note. Thank you, both of the speakers. You can pose your questions in the question and answer tab. You can have it. You can raise your hand. You have the raise your hand option. Or you can put your video on. I'm not sure we can actually see you, but we can certainly try to get in touch with you via by the video. And if you have problems, you can send us an email. Over.
So I see a question in the chat. Oh, and yeah, a raised hand. Marie or Mauricio, do you want to moderate how to answer the questions?
Sure. We have a raised hand. I'm not sure if it's the same question. So the person who raised their hand can unmute themselves, and the question is simply to whom the proposal is submitted to, and that's quite clearly defined in the expression of interest. If you have any questions, you can always send us an email to the same email here, but it should be clearly defined to whom you submit it. And then after submission, there is always an acknowledgement of receipt of your expression of interest, and then the communication starts. Of course, we'll keep you updated on the review, and we'll be contacting the selected proposals for presentations. But I believe that there is somebody with a raised hand, so please unmute yourself if you would like to. We have another question as well, which I'm sure you panelists can take a look, which are more technical, and I will let you answer them. There's one from Carmen Vela and one from Cedric. Can you both see this question, Marta and Vas? Very good. So I will let you see them, and I'll keep monitoring for any raised hands. Over.
Great. Vincent, do you want to address Carmen's question?
Sure. So we cannot provide at this point an indication on price estimation, but that's clearly something that will be looked at and assessed as part of the review process. Obviously, there will be a lot of price sensitivity for low and middle income countries. So we're looking at proposals that can really offer the best possible price. And also, as part of access commitments, what we'll be looking to do is look at price arrangements with applicants and manufacturers that are, for instance, on a cost plus basis. So we expect some transparency on cost of goods and also commitments to have a margin that is reasonable, that of course allows manufacturers to get a return on investment on what they're putting on the table, but at the same time that optimizes the affordability for low and middle income countries. I don't know, Marta, if you want to add to this, and maybe you want to take the question from Cedric. Sure.
Yeah, I would say just to add to what Vincent was mentioning, the TPP will have some guidance on the costs. It's a wide range. Yeah. So Cedric's question is the first one. I mean, at a high level, whether a single manufacturer can submit several proposals, and the answer is yes. And more specifically, if you have one for product development and one for manufacturing, a scale up, should this be in a single proposal or several ones? And I would say whichever you think is stronger. We accept several proposals from a single manufacturer if the two proposals are related and there is a way where they could be put together to make it stronger, so the two can be combined, then we would encourage that. But certainly if they are completely independent, we would take both of them separately.
Unmute Jayakar, so please go ahead and answer and ask your question.
Yeah, can I submit to that email ID that I have that EOI also submitted? That the slides also can be submitted the same email ID? No, the slides.
So, yeah, so if I understood correctly, I apologize because it may be my sound, I couldn't hear fully. But I think the question is for the submission of the slides, whether they should be sent to the email address or not. Yeah. So the answer is no, the slides should be submitted through the link on the website. So if you go to the website for the EOI, there is a link that says for submission, please click here, and it will take you to a specific web form to fill out very simple 3 to 4 fields just for storage of the information. And then there you will have an opportunity to upload the PowerPoint. Okay. So submissions are not taken by email. They will be taken directly from the web form on the website.
So the website address that I'm not getting that.
If you cannot find it, then probably the easiest is do send an email to the email address, and then we'll be able to point you out specifically on the website for the submission link.
Sure.
Yeah, please do. Just send us an email and we'll be able to address that.
Thank you.
Thank you very much, Jaykar. Both, we have an interesting question from Benjamin. A lot on product development, maybe Marta or Vincent, up to you.
Yeah, maybe I can answer Benjamin's question, or Benjamin. It's a good question. We're really not able to support very early stage proposals because of the timeline of the COI. The current funding period for the ACT Accelerator is about 2 years. And again, we're trying to respond to the emergency situation. And therefore, we're looking for relatively late stage development. That said, how early is too early? It's always a little bit subjective. The question is whether you are able to provide enough evidence of the promise of the proposed solution, do you have data to prove that this solution has really the potential of transform either performance or usability or affordability, right? One of the 3 aspects of the product that we're looking for. And then the second criteria is, if provided that there is enough support, even if it's early, is there an option to have that solution incorporated into a final RDT for manufacturing, say in the next 6 to 12 months? I would say that if the solution is so early that it cannot be incorporated within 12 months, it will be hard. It may still be considered for review, but it may not receive enough priority for funding, just because we need to ensure that within the 24 months we get the products to the market, and the sooner the better within those 24 months. Vincent, I don't know if you want to add anything there.
No, you covered that very well.
Well, thank you both. I don't see any other questions, and I don't see any raised hands at this.
We actually have a question. Sorry, Mauricio.
Oh, that just came in. Yes, I'm so sorry. Yes, and this is a question. At this point in time, we will make this presentation available through the website once the webinars are over. We will have another webinar later today or tomorrow for people who are in the East Coast of the US, in the West Coast of the US. And after these webinars are over, these are going to be posted just for information as part of the package, for information in the websites of Find and Unitate. And you've also noticed in the chat box that this webinar is recorded, so people can listen to the webinar and the questions and answers therein. Okay.
Great, and I can also address Cedric's question on the template for the slides. There is no template for the slides. Again, we're asking for 20, and in the EOI we have a few bullet points of the mandatory points to be addressed. We're not providing a template, again, because the EOI is so broad that it would be, we want to make sure we give every candidate enough freedom to present their idea. But do please make sure that you are able to address all of those bullet points that are indicated in the EOI.
Unless anybody sees anything else, I think that we're through these questions. We had foreseen that this was a targeted, quick presentation with quick questions and answers. So I think that we've achieved what we set out to do. Again, if you feel the need to listen to this again and ask questions live, we have another session coming out in about 10 hours. I want to thank everyone for coming in. Thanks, Marta, for having a very long day out in the West Coast of the US.
Absolutely.
Vincent, for coming up early, and some of you, wishing you all a good day. And thank you very much. Thank you for both of the panelists and everyone attending this.
Thank you very much to all of the attendees. Feel free to send more questions our way through the email address.
Thank you, everyone.
Thanks, everyone.
Bye-bye. Thank you.
Thank you.